anytime. They will say that they'll eat this, but after 5 minutes they will not eat that, and you have already given the insulin. So that's why monitoring sugars before every meal and giving the appropriate amount of insulin is the only way to treat them, and hence we cannot have fixed doses for them. Can we take injection just once or twice a day? Well, if only we could, but no, we can't. Especially in children, we can't, because their physical activity is different every day. Their meal pattern is different every day. Their food choices is different every day. They have birthday parties, they have school lunches, they have picnics. So depending on what they are going to eat, we have to adjust the insulin according to that. And pre-mixed insulin as given in adult cannot be and should not be given in children, because once given we cannot take back insulin. So if they do not eat, there is a very high risk of hypoglycemia, and especially during the nighttime hours, because during the day they keep on snacking. But in the nighttime hours, there's very high risk of hypoglycemia, which can go undetected and which can be very harmful for the child. Next myth is insulin injection we have to take 3 to 4 times a day. It will hurt a lot. But they are the needles are very small. In children, we use only 4 mm size needles, which are hypodermic, and they minimize the pain. And after 1 or 2 injections, they usually do not feel that they have the injections don't cause them pain. Where all can injections be taken? Well, in children, we usually prescribe them injections on the abdomen, thighs, buttocks. Usually we tell them not to take on the arms, because the subcutaneous fat is very less on the arms, especially in Indian children. And because of the needle size that we use, 4 to 5 mm, we have to just give it at 90 degree directly into the subcutaneous muscle. And we have to advise them to rotate the injection sites, because we are giving 3 to 4 injections in a day, and hence that is very important. Next is, can it be treated with oral medication or homeopathy or yoga or whatever new therapy there is? Well, currently there is only one treatment for type 1 in the world, which is insulin, and hence they might help with reduction in sugars, but they will not treat, they will definitely not cure diabetes. And can we stop insulin after achieving control? They're like, okay, the sugars have been normal for past 1 month, can I stop? Well, no, you shouldn't stop, because diabetes is an insulin deficient state, and you need to provide insulin for normal metabolism of the body. There is something called as honeymoon phase, which usually occurs 3 to 6 months after diagnosis and can continue till 6 months or even up to 2 years. So this is the phase wherein the insulin requirement reduces very low because of the recovery of the remaining beta cells in our body. And during this phase, people have claimed that the diabetes is cured, and okay, I've stopped my insulin and the homeopathy or yoga has worked. But they usually turn up in DKA after 6 months or so. So even though, however, minimum insulin has to be continued. Another question is, once you become adult, can we shift to oral? Because as per general population, type 1 diabetes is childhood diabetes, type 2 adult diabetes is only in adults. So now child is adult, he has shifted to type 2. Well, that is not the case, because both physiology is different. Next pillar in our management is meal planning. So there is another myth or misconception that there is some diabetic food and children with diabetes should eat only diabetic food. Well, that is not the case. They should eat a normal healthy diet. They can eat everything required because they need carbs to grow. So it's not that they should have carb-free or low-carb diet. They should have appropriate amount of all the nutrients, carbohydrates, protein, what we call as the plate method, wherein all the nutrients are taken care of. Next, another thing is, my child with diabetes cannot eat sweets or desserts, so I have stopped sending him to birthday parties. Well, that shouldn't be the case because, as I said, you should not separate them from normal children. Healthy meal plan with good sugars can be given to the child. Complex carbohydrate like ice cream, chocolates can be given for special occasions, and whenever given, you should account insulin for that and give appropriately a little higher amount of insulin in that case. Another pillar is self-monitoring of blood glucose, which is very important. First question they ask is, do we need to check sugar before every meal? And as I said, yes, checking before every meal will help in better control and prevent the complication. It will also help us because with children we don't know whether they are going to eat or not eat or what their previous physical activity is, because with physical activity the sugars will change, and hence self-monitoring is very important. So monitoring should be done at least 3 to 4 times a day before every meal. We should maintain a logbook because that will help us know how the control has been. HbA1c should be done every 3 monthly, and with the 3 monthly visit we should also be do growth monitoring and monitoring of comorbid conditions like the retinopathy and nephropathy. That the screening has to start after 10 years of age. We cannot wait for them to be adults and 20, 25 and then go to the respective doctors. We should start screening them once they turn 10. We used to have just one glucose monitoring device, which is the glucometer. Now we have CGMs, and then the latest will be the CGMs connected to the pumps, which forms a closed loop. So for the lower income, glucometers are the only one. I know even they are expensive, but with the Jan Aushadhi scheme, they are available at a lower price. The last pillar is the physical activities. Because the child has diabetes, they cannot play. They've stopped going for sports classes, or they've stopped doing any exercise. Well, that should not be the case. They need to exercise, and all sports are advised. Some of the sports which are like high intensity workouts, they can be done with proper precautions. Next are the long-term complications are less as compared to type 2. Well, the risk is in fact more in case of type 1 diabetes. The risk of retinopathy after 15 years of diabetes is 98%, and for type 2 is only 78%. Because type 1 is for a longer duration, and hence we should aim at maintaining euglycemia to prevent or delay the complication. Another question is, are any of the vaccines contraindicated in children with diabetes? Well, no, all vaccines should be given to children with diabetes, and there are no contraindications. The key messages from my talk are: maintain a high suspicion of diabetes in a child because it is very common. Immediate confirmation of the diagnosis with just checking of RBS, and initiation of treatment as soon as possible. And the main aim is to reduce the likelihood of decay. Thank you all. These are my contact details.